Had both of my knees x-rayed, and yeah, they had arthritis and a bunch of stuff. And I'd run for 45 years, and so I was wear and tear. And Letgolts said, "You should never have been a runner. You're bow-legged. You, you were going to put pressure on your knees, and they were going to come up and grab you sooner or later." And so they grabbed me. And I said, "Okay, I'm going to get a knee replacement. You agree?" And he goes, "Yeah, right, good." And he said, "But let's prepare you for it's what you do before and after that really makes a difference." So I joined a gym, and I mean, I worked out all my life, but I've always worked out at home. He said, "You need to do certain machines and strengthen your leg before you have the surgery." And so we did that, had the surgery, went well, and then post-surgery, he began to work with me in some ways that he's said, "Look, most people don't do what you're doing here to get rid of the scar tissue and strengthen the muscles." And so that was the post-operative thing that was really, really helpful.
Hello, I'm Dr. Letgolts of Letgolts Metaphysical Therapy, and today I would like to talk to you about the importance of physical therapy pre and post knee replacement and hip replacement. This would apply to all joint replacements, but we particularly see complications with improper treatment with hip and knee replacements. The most important and the most overlooked part of the recovery from the joint replacement is the understanding why the joint became damaged to begin with. Sometimes people fall and have an injury or have an accident and require replacement. That is a minor percentage of those who end up with knee replacements. For the rest of the people who undergo those surgeries, that happens because of long-term wear and tear due to improper mechanics of various joints in the body and compensation patterns that cause damage over a long period of time. If one does not address the underlying problems that cause the damage, ultimately the joint replacement is not as effective and does not provide as much relief long term. Some of the underlying problems that we see are excessive pronation, leg length difference, prior injuries or surgeries causing compensations for lack of strength, mobility, range of motion, and some of the potential weaknesses due to pre-existing conditions. All of that usually in our practice gets addressed and diagnosed prior to the surgery. The appropriate corrections are made, and then the program is designed to address those compensations prior to the surgery. In addition, prior to the surgery, patients already spent a significant amount of time in pain and compensating that causes its own set of problems that also need to be addressed to avoid long-term issues. After the surgery, let's talk about knee replacement first. So during the knee joint replacement, this part of the joint is replaced, and so in the process to access that area, an incision is made through the front of the knee, which leaves scar tissue not just at the skin, but going all the way through all the tissues down to the bone. As this scar tissue heals, it significantly restricts the ability of the kneecap to glide up and down. In a normal joint, when you bend the kneecap has significant movement with the femur itself. However, once you have scar tissue here and specifically here, the patella tendon no longer moves very well, and so when the knee bends, there is a lot more grinding at the joint in the groove, and that starts to cause significant amount of pain since we take thousands of steps a day, and so it's a very significant cumulative damage. And we end up having to address scar tissue contractures manually, quite aggressively, and the quicker this tissue starts to move, the sooner the patient starts to walk normally and pain-free. And very often that is what causes restriction in joint movement and pain, which eventually can become quite severe because the patients are told to just walk or bike and work through it to get strength, and unfortunately it just causes more and more damage. So understanding what needs to be addressed first before you can progress the patient to strengthening and range of motion is essential. Understanding what caused the damage to begin with is even more important, because then you can provide a full assessment and treatment and full prevention of future injury.